Big changes are coming to Medicare. The biggest one is changes to the Medicare drug program. How is that going to impact you? How about Ozempic? Will Medicare begin to cover Ozempic in 2025, the weight loss drug? I'm going to give you details about that. And then there's some changes to Medicare Plan B premiums. All that is coming up. So let's jump right into it. If you're new to this channel, hit the subscribe button, hit the like button, because all we do is bring you the latest news updates about Medicare, Social Security, food stamps, Medicaid, and any personal finance issues that affect seniors in and out of Congress. We want to be the first to bring it to you. So the news is all over the place. This is the New York Times. It's time to shop for Medicare, and 2025 brings big changes. CBS News, seniors will pay more for Medicare in 2025. Here's what you need to know. And the Wall Street Journal, Medicare plans are making big changes for 2025. Here's how to navigate them. And you have Investopedia, what project 2025 potential Medicare changes means for you. And this is a local news organization, big changes coming to Medicare. So everywhere you turn, there is news about Medicare. So what I did was I took all this information and then I dissected it, and I'm bringing you the 12 big changes to Medicare that are going to have the most impact. So let's get right into it. So the Inflation Reduction Act of 2022 introduced major changes to Medicare reforms for 2025, focused on making prescription drugs more affordable. This is the biggest change since Part D, since Medicare Part D was introduced in 2006. The new $2,000 cap ends the confusing donut hole system where seniors had to pay varying amounts at different coverage phases. Now there's a clear maximum limit. A flexible monthly payment system also lets you beneficiaries spread their drug costs throughout the year instead of paying a large upfront fee to the pharmacy. And then these changes apply universally across Medicare drug plans, whether you have a standard or standalone Part D, or you have a Medicare Advantage, and this is to ensure consistency. So let's dive right in. The first change is the 2,000 out-of-pocket cap. Once you reach the 2,000 out-of-pocket spending on covered medications, you are completely covered for the rest of the year, no matter how much your drugs cost. This replaces the old complicated system where you move through different phases: deductible, initial coverage, donut hole, catastrophic, with different payment amounts at each stage. The cap includes everything you pay yourself, including deductibles, co-payments, and your percentage of drug costs, which is co-insurance. Plan premiums don't count towards your cap. So the premiums that you pay towards the plan does not count towards your $2,000 cap. About 1.7 million Medicare beneficiaries currently spend over $2,000 annually on medications. That's a lot of money, and this change is supposed to help with that. The second change is a monthly payment plan. This is really, really big deal. The new payment plan works like a subscription service. Instead of paying hundreds at the pharmacy, you can spread it over 12 months at 166.67 a month or less. The monthly cap is calculated by dividing $2,000 over 12 months. Unlike typical payment plans, Medicare prohibits charging fees. So even though they are allowing you to pay it over 12 months, they're not going to charge you a fee for that convenience. Change number 3, Part D premium changes. Most popular plans are seeing significant premiums increases despite average decrease. The base premium increase to $36.78 represent a 6% rise. Also, plans participating in government stabilization programs can raise premiums up to $35 a month. Most beneficiaries will see an increase limited to about $2 monthly due to federal premium stabilization efforts. So this is good news. Standalone drug plans are actually decreasing on average to $40 a month, making coverage more affordable. And Medicare Advantage plans with drug coverage show significant savings, dropping to $13.50 on average, a 13% decrease. Change number 4, Medicare Advantage changes. 60% of enrollees will pay a drug deductible in 2025, up from 21%. So that is not heading in a good direction. Average deductible increases from 59 to 225 for these plans. That is a big gap. Some supplemental benefits like dental and vision might be reduced or restricted or restructured to maintain plan affordability. Medicare is implementing stricter rules about having enough doctors and specialists in network to ensure real access. Let's talk about change number 5, mid-year notice. This is new. Starting in summer 2025, Medicare Advantage plans must notify members about unused benefit they've paid for. This is a big, big deal. It means that the notice will detail how much of the remaining coverage you have left. So if you haven't used your dental plan or your eye exam or your hearing aids, you're going to let you know. Then the plans are required to provide clear steps on how you can access these benefits, making sure that unused benefit don't go to waste. The transparency initiative helps members get full value from their plan before the year end. Change number 6, mental health expansion. Medicare now accepts more types of mental health providers, including marriage counselors and addiction specialists. The program is actively recruiting more mental health professionals to improve access to care. Telehealth for mental health becomes a permanent benefit, not just COVID era temporary measure. Plans must verify their listed mental health providers are actually accepting patients and prevent ghost networks. Change number 7, the guide program. The dementia care program expands dramatically from 96 to 390 organizations across the country. Caregivers also get access to 24/7 professional support for handling dementia related challenges. A significant 2,500 yearly allowance helps pay for respite care, giving family caregivers needed breaks. And this program specifically targets original Medicare beneficiaries with diagnosed dementia who aren't in nursing home. Change number 8. There's a 26% reduction in plan consolidation. So this is actually supposed to help provide more choices. 5% of Medicaid Advantage plans and release are terminated in 2025. 7% will automatically be moved to different plans. Major insurance are combining or ending plans. So this is where we're seeing a significant decrease in options, and that's not good news. But it has become a trend and is just accelerating, which is offering seniors less and less options. Number 9, plans must stay study how their approval requirements affect seniors who are more vulnerable to care delays. So this is about authorization for particular conditions or particular treatments or particular visits that need prior authorization. And sometimes this causes a lot of delays. And so now there's a law requiring each plan to study how their requirements cause delays. Response time for approval requests cuts in half to 7 days by 2026. That is the goal. Authorization can only verify medical need, not add extra requirements. So it means that when you send or Medicare sends for prior authorization, they cannot nickel and dime you on other things. They just have to make sure that they're focusing on the medical need and are approving or denying it based on the medical need. And plans must follow original Medicare coverage rules, preventing arbitrary denials. Number 10, the drug plan that I was talking about. Medicare gains unprecedented power to negotiate directly with drug manufacturers. The first round of negotiations completed for 10 expensive drugs with lower price starting in 2026. 15 more drugs enter negotiations this year in 2025. So you're going to see more reduction in the most commonly used Medicare drugs and probably the most expensive of them all. New manufacturer discount programs also provides additional savings to you in addition to the $2,000 cap on prescription drugs out of pocket costs. Change number 11, Medicare Part B premium. Monthly Part B premium rises to $185 for most beneficiaries. This is where a lot of seniors are really, really not happy because they got a tiny Social Security increase of 2.5%, but Medicare Part B premium is going up. And so that eats up the little Social Security increase they got. And some of them even are in a deficit because the Social Security increase they got is not enough to cover the increase in the Medicare Part B premium. On top of that, those who are on food stamps are losing food stamps or getting letters that their food stamps have been reduced. So it's not a good situation right now for a lot of seniors, given how these price increases are happening and the cost of living adjustment is not matching up. Higher income beneficiaries pay more based on their income. The premium is separate from prescription drug coverage and applies to medical services. Ozempic, Medicare weight loss coverage. Medicare now covers certain weight loss drugs when prescribed for health conditions like heart disease. Wegovy, specifically approved for cardiovascular disease patients who are overweight. Coverage expected to expand as FDA approves these medications for other medical conditions. So stay tuned. But now you know some of the weight loss drugs out there are being approved for Medicare if it's for a medical condition. And these medications fall under the 2000 out of pocket maximum. So if you're approved for Wegovy for health reasons under Medicare, these medications fall under the new 2000 limit. So if you my understanding is that it's $1,000 a month to get these injections. So after 2 months, now Medicare has to pay the rest for the rest of the year because you've paid your $2,000 limit, or you've reached the $2,000 out of pocket drug limit. So that is good news. So if you think you qualify, you should reach out to your doctor and see if you fall under this rule. So watch for your annual notices. You probably have received it already. And then use October 15th to October 7th for enrollment, which is going to be later this year. Review plans to make sure that you are picking plans that work for you, and double check your doctors and medication to make sure that they remain covered for 2025. If you have any questions at all, let me know in the comment section. If you're new to this channel, hit the subscribe button, hit the like button. If you like what you hear, share this video so that more people will get to see it. And I'm going to come on live tomorrow with more information. So stay tuned. So until then, thank you for watching.